Hi, I'm Dr. Rhonda Patrick, and I'm going to be your narrator for this particular training course. Before you start your training course, I'd like to talk with you a little bit about why training is so important. Like you, I have worked in a variety of healer or helper jobs, from direct care to clinical staff to administrative staff. And so I understand that training, especially mandated training, can be time consuming and frankly inconvenient. But training is really important. It's more than about checking off a compliance or a regulatory box. It's more than about just getting it done. It really is our ethical responsibility to the people that we serve. First and foremost, training is about what I like to call organizational enculturation. This is how you get to really know the mission and principles of the organization that you have agreed to work for, and to make sure that those principles and practices and the mission aligns with your own personal and professional practice principles, life principles, and mission. You chose to do this kind of work. You chose to become a healer for a reason. So you want to make sure that the place where you're doing your chosen vocation lines up with that vocation. Secondly, training really ensures the safety of the people that we're trying to help and our colleagues. So the person's receiving care and giving care. Many of our clients, especially in addiction treatment, come to us in a very distressed state. They have a life-threatening illness. And when we don't provide them high quality, competent, ethical treatment and care, we endanger their lives. Training helps to ingrain the necessary behaviors, attitudes, skills, and knowledge that you most likely come with, especially if you've been working in this field for a while, or even if you've just gotten out of school. You come with some knowledge, some skills, some attitudes and beliefs. And we want to pair up those that you bring with you with those of the organization so that you grow as a healer. And we want you to grow in this organization. When we do that, when we grow competently, then we're able to really deliver that high quality patient or person-centered care. Training also helps us to take the right steps in making decisions, in carrying out services so that we prevent risk to our clients. It prepares you how to respond correctly when something comes up, when a risk emerges that requires your immediate attention in the course of delivering care. Training helps keep everyone safe. Without the right training, something minor or major is likely to go wrong, and you could be held responsible for that. And this could put a lot of people at risk. It could put the clients at risk for emotional and physical harm. It could put your colleagues at risk. It could put you at risk for professional, emotional, physical harm. It could put your organization at risk. So we want to eliminate those opportunities for risk. Understanding how to communicate more effectively, how to manage people who have difficult emotional circumstances, behavioral difficulties, and helping them to be able to work towards their personal outcomes. Remember, our clients are here because they want a better quality of life. However they've told that to you, that's what they're after. So how do we help them to do that? All the training that you're going to take, including this one, helps you to be able to provide good quality of care, competent quality of care for all the people that you will serve in any service industry that you choose to work in. Our commitment to you as the developers and deliverers of training is to give you content that's useful, meaningful in today's practice world. As such, we try to update our training. We use a multitude of training tools, from video, a talking video like this, to audio, to written narrative like you're reading in the side screen over there, to embedded videos from open source places like YouTube or those kinds of places. Every training will have an outline and an introduction, and in the introduction, your narrator will highlight for you the concepts that are going to be important for you to really pay attention to. That doesn't mean to skip through the rest of the training. What that means is that we want you to focus in on these concepts. The narrative or the embedded videos or the embedded audio is there to support and illustrate those core concepts. So watch through the whole thing. Don't be tempted just to scroll through as fast as you can just to get done. At the end of your course, you're going to have an exam, and our exams vary. Some are very perfunctory. Did you review this information? Yes or no? Some have true and false questions because the details are important. Some have multiple choice questions because we want you to think about the different options that you might have. And some have application questions. What would you do in this situation? Because we want you to be able to apply the training. The tests are not intended to be hard. They're not intended to set you up for failure or to stress you out. So there's no need to have test anxiety. And we give you lots of opportunities to retake the test if you need to. But I'm going to say that if you go through the entire training and really put effort and time into reviewing all the concepts of the training, then you won't need to take that test more than one time. When you've completed the test, you're going to be asked to complete an assessment. This is a survey. We use this survey at BHC Training to improve our training. We want the training that you use to be meaningful, to be useful. So if we don't get feedback, we don't know what's not working or what's working really great, or what you need more of or what you need less of. So take the time to fill out the surveys. Again, like other things that seem inconvenient, those surveys are intended to make your experience next year and your experience in future years better, more meaningful, more useful, so that when your supervisor or when your human resources department says, hey, it's time for you to take your annual training, you don't roll your eyes or sink in your chair or groan internally because it's inconvenient and unuseful. So fill out those surveys, those assessments. I thank you for your time and your investment in this training. And I know that your clients will thank you and your organization will thank you.